So LP is both diagnostic and therapeutic at the very same time. So what are the indications for LP? You can say viral, bacterial, fungal meningitis. It is also used for any carcinomatosis tumors or carcinomatosis meningitis. It is used for high intracranial pressure. When we use it in high intracranial pressure, it is being used as a therapeutic tool. It is also used for diagnosis of Guillain-Barré syndrome. So step 1 of the procedure is to gather the supplies. So what supplies do you need in the lumbar puncture? The first is 20 or less than 20 spinal gauge needle with a slight stylet. And then you'll also need a 25 gauge of needle and syringe for local anesthesia. Then you'll need 1 to 2% of lidocaine solution for local anesthesia. Then you'll need drape. Then you'll need sterile gloves. All those are very important and maintain the sterility all the time. The patient needs to be in lateral decubitus position like this. Third step is find the L4 or L5 space of the patient, as most of the adults, spinal cord ends at L1 and some spinal cord ends at L2. So you need to be sure that you're not puncturing the spinal cord, or else it will create problems. That's why you use the space L4 and L5. So the surface landmark of L4 and L5 is, we draw a line that is called Jacobi's line, which crosses both the iliac crest, and it is in the midline. So that's how we know it is L4 and L5. Of course, we have to paint and drape the patient for the process. Then we insert the needle. Initially it should be perpendicular, but then we proceed towards the umbilicus. After penetrating skin and subcutaneous fat, the needle should penetrate through supraspinatus ligament, then interspinous ligament, then ligamentum flavum, then the epidural space, and then the dura. Once the needle is inserted for about 3 to 4 centimeters inside, you'll feel a little bit of pop or loss of resistance. That means we are in dura. You can remove the stylet and see if the CSF is coming or not. If the CSF is not coming, then you can insert 2 or 3 centimeters more inside and again check by removing the stylet. The needle is in the lumbar cistern. You can use a manometer to measure the CSF pressure. The normal pressure of CSF is 8 to 10 centimeters of H2O, and the pressure is slightly elevated in obese patients, but that is normal. If the color of CSF is slightly bloody, then that means you did a traumatic tap. If the color of CSF is yellowish in color, that means there is some blood products inside CSF, and that would indicate 12 or more than 12 hours of subarachnoid hemorrhage. Post LP, the patient should be advised to stay in the supine position at least for 1 to 2 hours. That would help in reducing headaches. If the patient is having headaches, that is because of LP, then you can advise him some form of caffeine, paracetamol, or you can even give him plenty of fluid.